Hey, beautiful people of our beautiful morning, beautiful afternoon, and beautiful evening to every one of you. How are we all doing, guys? I know we're doing amazing, all right. In today's video, we are going to be talking about family planning. Things are getting better. Things are getting better. I supply my family in the name of the Lord. Things are getting better. Things are getting better. Lovely morning to every one of you. This morning, I bring you good news. It is very important for every one of us to be able to plan our family. It is important for our fathers, it is important for our mothers, and it is important for the young girls and the young boys to be able to understand what family planning is. And what is family planning? Family planning generally is preventing yourself from having more children than you can cater for. Or family planning could be seen as a means of spacing children. Maybe you don't want children very quickly. You don't want to have children. You give birth this year, you give birth next year. So family planning is like spacing them up and having children at your own time and at your own convenience and having the exact number of children you want to have. Now, what is the benefit of family planning? Things are getting better. Things are getting better. As I plan my family, daddy's getting richer, mommy's getting younger, children getting happier. That is it. Daddy gets richer because he's able to manage his income with the amount, with the number of children he has. Mommy's getting younger because she's not going through a whole lot every year and giving birth to children. Children are getting happier because the resources is enough for the family. Now, what are the different types of family planning? There are a whole lot of family planning. Firstly, I would like to start with the ones that are natural, with the ones that you don't have to remember anything. You know, there's some family planning that, oh, I have to remember, I have to do it today. No, I'll start with the ones that, to a large extent, you don't have to remember anything. You don't have to do little or nothing. But this family planning is really very effective. So there are a whole lot of family planning. One of them is what? IUD, which is intrauterine device. We have implants, we have tubal ligation, we have vasectomy, we have oral contraceptives, we have condom, we have the calendar method, we have the secretion method, we have the withdrawal method, and we have the diaphragm. Yes, these are the different types of family planning method we have. Before we dive into each of them, if you are seeing my pretty face for the very first time, my name is Violet Okolocha. I'm a registered nurse. I live and I practice in the United Kingdom. And on this channel, I just want to bring to your notice, because we hit 1 million views, because I help nurses in the United Kingdom, new nurses, pass their OSCE exam in 4 sitting. And so since we hit 1 million views last week, I said to myself, I'm going to be bringing health topics to the doorstep of every one of us. So you don't want to miss any update. So like this video, subscribe to this channel, and don't forget to share, because trust me, you're going to benefit from this health discussion. All right, so let's dive in to this video without wasting any more time.
Ryan Little.
So guys, welcome back, and let's talk about IUCD, or IUD as people all know it to be. So this IUD, it's very, very easy. It is invisible. If you carry IUD, nobody knows unless you tell them I have an IUD inserted inside of me. So nobody knows. So it is invisible. No one, absolutely no one can tell you have it. And it is good for women of all ages, whether you're middle age, whether you're 20, whether you're 18, whether you're 30, whether you're 40, and you are still of reproductive age, you are still of childbearing age. IUD is good for you. And how is IUD done? It is placed through the vagina, through the cervix, and down into the uterus. So If you carry IUD, or if you have IUD inserted, it is easy for you, and it lasts for like 7 to 10 years. All you need to do is, when you get IUD inserted, just follow up with the appointment of your midwife, of your community extension workers, or of your doctor, because sometimes they tell you, can you come 6 weeks so we have a look? Can you come 1 month? Can you come 4 years? Can you come? So just follow their instruction. Okay, it is easy to insert. I used to insert IUD when I was in Nigeria, and it just takes like 5 a maximum of 10 minutes. Is it painful, Nurse Violet? Just a bit. You just feel somebody is going inside of you. You just feel like something is going inside of you. So you might just experience uterine cramp. You might just experience some little pain, but trust me, it wears off immediately. Now with IUD, you may experience like heavy bleeding for some time, but the thing is, you just have to be patient. When you insert an IUD, this is a foreign object inserted inside of you. You understand? It's not like it's part of your body system. So you may experience some symptoms you were not experiencing before, like some heavy bleed, like some dizziness, but it wears off within a maximum of 6 weeks. So IUD is good. It's a very effective method of preventing pregnancy. It is cheap. It is easily available. It doesn't stop anything. If you want to have more children, probably you are using IUD as a spacing method, and you want to have more children, you get it inserted, and trust me, if you get the IUD taken out today, you can get pregnant tomorrow. That's how good it is. I remember when we had an infertility case in my clinic back when I was in Nigeria, and the doctor was like, let's try IUD. We just insert it, and after like 2 months we take it out, and it was done for the lady. And by the time we took IUD out, the lady who was not conceived in 10 years of marriage, she just took it. That's to tell you, IUD does not affect your fertility at all. So if you want to use IUD as a spacing method for family planning, you don't want more children for now, but you may want later, it is really, really effective. Most people think it travels around the body. It doesn't travel around the body at all. It just stays where it is put. It's supposed to be put in the uterus. So it goes through the vagina to the cervix, and it just stays there. All right. So you can see the picture of IUD if you do not know IUD. Now that's all for IUD. Number 2 is the implant. Oh my God. The implant is another very good method. Very good family planning method. I will encourage anybody anytime to do. So for the implant, it is being inserted in the hand. Now, most people think that if I insert implant, people will know. Nobody knows. So we insert implants just towards this part of the arm. You know, as I'm putting my hand here now, if I have an implant, you wouldn't know. Even if I'm wearing an handless, if I have an implant, you will know. We don't put it here that everybody sees. So it's usually by the side of the hand. So what is the implant? It's just a little plastic rod. It looks like a matches. If you know a matches, that's how an implant look like. It's just like a little plastic rod, and it is placed under your skin. So implant is really good. Like I said, it lasts 3 to 5 years. So with implants, you may not see your menses at all. Most women who has implant do not menstruate at all, or each time they menstruate, they just have a very light menstruation. The question now is, Nurse Violet, if I do not menstruate, is the menses or is the blood not building up in my body and later I'll be sick? No, the blood is not built up in your body. The implant is an hormonal way. It works hormonally. It's not something you can understand if I explain it, but trust me, the blood is not built up in your body. So even if you're not menstruating, that's absolutely fine. It doesn't affect you in any way. It doesn't affect your health in any way. And like I said, the implant lasts 3 to 5 years. It doesn't travel around the body. If you want to take the implant out, it's easy. Just go back to where you got it inserted, or go to any healthcare provider. Say you want to take out your implants, and probably because you want to have more children, or for any reason best known to you, and they take it out. So you can see the picture of an implant there, and you can see the picture of how it's taken out. It's that easy, guys. So the implant is a very good family planning method. I'll recommend anytime, any day. And like any other family method, when you insert the implant newly under your arm, you may have some symptoms. What are the symptoms? You may have headache. Oh my God, your head is aching you. You may have dizziness. You may have cramps, but it's just normal. It wears off immediately. Remember, these family planning methods are not used to your body system. So once you start using them, initially you will experience some symptoms. My advice is be patient and let it get used to your body system, and then the symptoms wear off. Because most people will insert IUD, and they say, oh, I can't cope, oh, I'm having heavy bleed. Can you just be patient and let it work? Let it get used to your system, and you see that all those usual side effects just wears off. All right. So dad is getting richer, mom is getting younger, children getting happier. So everybody should do family planning. Number 3, family planning. This one applies only to the men. The name of the family planning is Vasectomy. But from where I come from, Nigeria, I'm from Nigeria, I don't think a lot of Nigerian men would love to do this family planning. Or generally, I don't think men would like to do family planning. But for those men who would like to do family planning, vasectomy is the best family planning method for you. How is it done? Vasectomy is a simple sterilization method. Very simple sterilization method. It is very, very simple, meaning it permanently prevents a man from getting a woman pregnant. And I think that's why most men do not like to do it because it's permanently. So if a man does vasectomy or gets vasectomy done, he can never, ever, ever pregnate a woman. So it permanently prevents a man from pregnating a woman. However, it does not affect the man's sexual life at all. The man still sexually enjoys himself. The man still sexually feels happy and he still has sexual fulfillment. So it doesn't affect the man's sexual life. But it's a permanent family planning method. So if you're a man and you would love to do it, kudos to you. So go ahead and discuss with your healthcare provider and they'll get it done for you ASAP. Number 4 family planning today is tubal ligation. Tubal ligation is usually done most times when women have cesarean section. Not always. It depends on the woman's age. Most doctors would not love to do tubal ligation for a woman who is under 30. Same, most consultants or most doctors will not also love to do tubal ligation for a woman who is 30 something. So it depends on your consultant or on your doctor. But this family planning method is usually beneficial for women who usually deliver through cesarean section. So probably you've done 4 CS and you're probably like 39, 38, and you tell your doctor, can I have my tubes tied? They might consider it. But even if you've had 4 children and you're like 25 and you're telling the doctor, can I get my tubes tied? They are very skeptical about it, because it is almost like a permanent family planning method. Or should I say, it is 75%, 90%, 100% a permanent family planning method, just like the vasectomy. So in this case, your tube is tied. It is a permanent. Why I say permanent is because the woman can never conceive. You know what I mean? So it is a permanent family planning method. The fallopian tubes are tied, or the fallopian tubes are cut, or they are blocked permanently. This procedure does not affect the woman's menstruation in any way. It does not affect the woman's sexual life in any way. It is just a family planning method, meaning the woman still can have sexual fulfillment. The woman can enjoy her sexual life. So tubal ligation is to be considered if you want it and you deliver through cesarean section, and of course your doctors and your husband are happy for you to do it. So like I said, things are getting better. Things are getting better. As I plan my family in the name of the Lord, that is getting richer, mom is getting younger. So plan your family. Do not have unwanted children. Plan the number of children you want to have. And the final family planning method I have for you, we call them contraceptives. There are a lot of family planning under contraceptive. For example, the use of drug is part of contraceptive, and one of those drugs is oral contraceptive. Oh my God, I would not encourage anyone to use oral contraceptive. Why? Is it bad? No. Is it effective? Yes. The only reason is because oral contraceptive, you have to take it every day. Yes, it has a lot of times. You have to take some every day, the same time. And most women are so carried away with the economic in various countries today. Most women cannot remember to take that drug every time. And so if you don't obey the rules of that drug, like taking the drug every day, every day, and at the same time, it will not be effective for you. So that's why I said I would not encourage this family planning. If you are the type of women who has a lot on your brain and you're not able to remember to take this drug at a particular time every day, then this will not be effective for you. All right. So it is effective for people who can take it at a particular time every day, and that's how effective it is, and that's how effective it works. So there are another oral contraceptive family planning which you take for 3 weeks, and then the last week you do not take it. And if you do not take it for the last week, you menstruate. So that last week you're not taking it, that's the week you menstruate. So you take it for 3 weeks. So there are different oral contraceptive. So they are the ones you take permanently every day. They are the ones you take for 3 weeks. You have a break of 1 week and then you continue taking it. But the problem is you have to remember the date. You have to remember to take it every day, and you have to remember to take it at a particular time. So if you are the kind of woman like me that I'm very busy, like I don't even have time to remember to take a drug, then I don't think this family planning is going to work for you. Another family planning under the contraceptive is condom. Oh my god, condom is usually good, and of all the family planning, condom is the only family planning that prevents to some extent sexually transmitted disease. So condom is good, but the problem is there are a lot of issues with condom. If the thing becomes too much and it's bursts, you could get pregnant. So that's the problem with it. So but if you can use condom effectively, and that's absolutely fine. We have the female condom and we have the male condom. So it's up to you, the man, and it's up to you, the woman. So outside that, condom is effective. It prevents you from also having sexually transmitted disease. And to a large extent, if you love condoms and you're okay with it, because most people are like, oh, I feel like I'm not doing anything with condom. So it's up to you and your partner to decide that entirely. And the next one I have here is the diaphragm or the cap. That is being inserted through the vagina, and it prevents sperm from traveling. So the diaphragm, I will try to share it with you on my screen, is being inserted in, or is being inserted through the vagina, and it prevents sperm from going in. They call it the diaphragm or they call it the cap, whichever. You can call it the diaphragm or you can call it the cap. So it prevents sperm from really traveling down so that there will be no fertilization. That's what it actually does. And if you have sex, you insert it before you have sex and it stays like 6 hours, then you can take it out. You know what I mean? So the diaphragm is also good. It's also effective. So there are a lot. So there's nothing like, oh, I made a mistake. No, you just have to discuss all the family. You just have to discuss family planning with your provider, the community extension workers, with the nurses, with the doctors, and you go through them and they see the one that works for you. All right. And another one we have are the injections. We all know the injections. The problem with the injection is that you just have to remember to take it every 3 months or every 2 months, depending on the type. Like the Depo-Vera injection, they usually take it every 3 months. We now teach women how to give it to them by themselves. So if you're a woman and you're happy to, give yourself the injection every 3 months, the healthcare provider are happy. They'll teach you how to do it and they will give you to give yourself. But the thing is, you have to remember to take it every 3 months. If you don't remember to take it every 3 months, then of course you're going to be productive. So as a woman, you really need to do family planning, or as a man, or as a couple, or as an individual, you really need to do family planning, because you don't want to have unwanted children, or you don't want to have children who you do not have the resources to cater for. Final family planning method I have for you today is understanding how your body works, and that is understanding your menstrual cycle. I have done a video on how to understand your menstrual cycle, your ovulation cycle, your safe days, your fertile days. Go and watch the video. I'll keep the link in the description box. So when I did that video, a lot of people were over me. Nurse Violet, can you help me calculate? No, you have to do it yourself so that you understand how your body works. Now, Nurse Violet, I have a problem. Mine is irregular. I have also done a video on how to calculate your menstrual cycle, your safe days, your fertile days, your ovulation, and everything you need to know about irregular menstrual cycle. So go and watch it. The truth is, every woman should understand how their body works. If you know how your body works, you just might not need any family planning. So if you are on your safe days, you have fun, have sexual pleasures as much as you want. Then if you are on your fertile days, then you use condoms. So you don't have to crack yourself and say, oh, I have to do this. No, because you understand how your body works. So I use the natural family planning method, just as I've mentioned to you, understanding your body system. And of course, it works for me. It works generally for everybody. If you understand your menstrual cycle, understand when you're ovulating, understand your fertile days, understand your safe days, then whenever you are not safe, then you use your condom and it works. Trust me, guys, it really works. And if you also have an irregular menstrual cycle, understand your irregular menstrual cycle. I've done a video on that. Watch it, understand how it works, and you see, if you don't like any of the family method, you use your natural family planning method. Another family family planning method is the secretion method. Yes, it's also a natural family planning method. What does the woman do? You check yourself and you know when you are fertile. Like if you're ovulating, every woman who understands their body system knows they are ovulating, because if you put your hand there, you see the secretions coming gradually, slimy, a bit drawing, and through that secretion, you can also know the main date of your ovulation. And if you're looking for a male child, that's the good time. So you just have to understand your body system to know how it works. And if you're looking for a female child, just before that main ovulation, you know what I mean? So understand me, thank you. All right, guys. So that's it. So understanding how your body works. I've done a video. Just go check that video out. So breastfeeding is a good family planning method. However, it is not very effective. So if you're doing breastfeeding, you say my menses has no return. No, I'm enjoying myself. Oh, I'm giving baby breast morning, afternoon, and evening. It is not very effective. So make sure if you're doing breastfeeding, just try to still protect yourself, because you just might get pregnant. And if you don't want that, then you have to try as much as possible to protect yourself by doing any of the family planning method. Smash the like button if you find this video effective, if you find this video useful. Share this video with a number of people. I have tried my best to make this video in simple language that everyone can understand. Thank you so much for watching. I will see you in another health video. Until I see you again, keep living the best. I love you all, and bye for now.